Have you ever had a patient on vasopressors and you notice their fingers and toes start to turn this purpley color? No, this is not frostbite. This is actually digital ischemia that's caused from vasopressors, especially in higher doses. We use vasopressors in patients that have a lower blood pressure, and they're administered to help patients sustain a blood pressure to help perfuse their organs. However, when patients are receiving lots of these medications, it can cause the digital ischemia, which actually can lead to gangrene and require them to get an amputation at a further date if the patient survives their initial complication of what's ever causing their blood pressure to be that low. It's associated with high morbidity and mortality, and every time I see patients starting to get these purpley fingers and toes, immediately my red flags are up and I'm like, ooh, this is not going well. The two main vasopressors that you will see kind of being the culprit of this are norepinephrine or Levophed and epinephrine. And this is because these vasopressors have strong alpha adrenergic receptors, and this causes vasoconstriction. And when you have vasoconstriction throughout your body, you're still going to get it in your fingers and toes. And these vessels are obviously a lot smaller. And then when they're constricted down, the blood flow is compromised. Here's another picture of a patient's hands. Ugh, just not good. So what can we do as nurses about this? Well, one, if you notice it, notify the provider that's in charge of taking care of the patient. There's not a whole lot that we can do because while it's obviously going to be a problem if they are losing blood flow to their fingers and toes, the most concerning problem is going to be that they have the low blood pressure and we need to treat that first. So this is just a side effect or result that comes from using vasopressors. But sometimes you'll see providers order like a nitro paste to be placed on the purple part to help kind of vasodilate some of those capillary beds and perfuse them. However, there's not a whole lot we can do, and you kind of got to ride it out. Hopefully the patient survives their initial reason why they are so critically ill, and then the digits, if they don't, if they die off, they can figure that out at a later point.